Danae Mierau, and I am one of the general managers at KARE. More recently, I've had the opportunity to work with our team as we launch the new vertical into the therapy space. Really excited to be providing our senior living communities and our seniors with more ways to get the therapy services that they need. Today, we're gonna focus on a topic that I'm extremely passionate about, which is movement is medicine for our seniors. Before we dive in, I'll give you guys a little background of where I come from and where this passion comes from, on how we get our seniors to be more active and how by getting them more active, it helps our care force do their job better and more efficiently and also more safely. I am a physical therapist. I was a rehab director at a senior living community for 2.5 years. I then transitioned into the executive director role at that community. It is a community that is focused strictly on providing care for individuals with cognitive deficits, dementia, memory loss. Love that population. I hate the diseases, but I do love that population and I'm passionate about keeping them active. When I transitioned into the executive director role, there were 2 challenges, one more of a challenge and one more of a frustration that I wanted to take on. One was the challenges that we have in senior living with staffing. Staffing is challenging. We all know that. If you're listening to this, you're probably like shaking your head. Yep, I'm aware. Staffing is challenging. And the second one is more of the frustration of seeing our seniors not get the physical activity and the exercise that they need, and how we often take a reactive or a medicinal approach when we could use movement as medicine to be a more powerful approach for our seniors. So let's dive in. Today we're gonna go over 6 ways that we can use movement as medicine, and then take that one step further in how that impacts our caregivers' ability to care for our residents. So number 1, movement is medicine to decrease and eliminate pain or prevent pain as well. I'm sure that we've all been on a recent flight at some point in the last year and a half. Right around that hour mark, we're humans, we're designed to move. We have that urge to relieve pressure off of our butt, stand up, go to the bathroom, walk the aisles, maybe do some calf raises in the aisle if you're a physical therapist or if you're like me. But the moral of the story is we're designed to move, and we're not designed to stay in one place, one position for extended amount of times, because that causes pain in our joints and our muscles. And so when our seniors are not active, it increases their pain, oftentimes leading to medication interventions when we could have just been proactive in getting them to move more. What this does for our care force, pain medications absolutely have side effects, not always the prettiest ones, constipation. Sometimes they don't control the pain well, and then the resident just gets frustrated. And when residents are in pain, they're more difficult to take care of. Pain makes anyone grumpy. And so then our caregivers, that burden of care is increased because the resident is in pain. It's more difficult for them to move them for EDLs. If we take the proactive approach, we keep people moving, it can really, really help manage and decrease resident pain. Number 2 is wounds. Very similar to the pain conversation and point that we just went over. Our bodies are bony. Those bony prominences are not designed to have forces exerted on them the same way for an extended amount of time, because it causes pressure ulcers, it causes wounds. When a resident has a wound, we know that their plan of care gets more extensive. They require more care, wound care nurse, wound interventions, medication to prevent infection. Moving that resident is a lot more painful and a lot more difficult on our care force. And so if we find ways to proactively move our residents through different positions throughout their day, we can prevent those wounds, helping the caregivers and helping the nurses decrease that likelihood of having a more extensive plan of care. Number 3, we're going to focus on our individuals with cognitive deficits. A lot of people will say these people have behaviors or they're aggressive. We're going to call them behavioral expressions, because when a resident is exhibiting a behavior, they're trying to communicate something with us. Yes, sometimes it's probably that they have to go to the bathroom or they're hungry, they need something, but I think we miss the mark sometimes in that they just need to move, especially for our individuals that are primarily wheelchair bound or primarily spend most of their day in their room. The residents that are maybe more isolated, sometimes they just need to get up, move, exert some energy, and then they're not going to have that combativeness or physical or verbal aggression when our caregivers go to get them in the shower or help them change. So if we're proactive with getting them to move throughout the day, exert that energy, our caregivers can be more successful in completing their plan of care. Number 4, movement is medicine, and it helps decrease fall risk. No one likes falls. What we know is when a senior falls, their likelihood to fall again increases exponentially. They also become more fearful of falling, which discourages them from future activity, future mobility, and we see a decline relatively quickly, because if you're not using it, you're losing it. From a care force standpoint, when a resident falls, no one likes calling the family to notify that their loved one fell. No one likes filling out the incident reports, and no one likes the injuries that often occur as a result of a fall. So if we keep them moving, we keep those muscles active, absolutely can decrease the fall risk, decreases the burden of care for the caregivers, and it increases that resident's confidence in their ability to move and maximize their independence. Which transitions me to point number 5, movement is medicine, and it helps maximize our residents' independence. We don't like when a resident has to go to a higher level of care. The resident doesn't want to feel dependent either. They want to be independent as possible. But again, going back to the point of if you don't use it, you lose it. When our residents aren't constantly standing up and sitting down off of a toilet, walking, exercise classes, getting out in the community, their independence is going to decline. And what that does for our caregivers and our care force is it increases the likelihood of that resident needing a 2-person assist. It increases the lifting needs on the caregivers to get that resident through their ADLs and through their plan of care. And it increases the likelihood that a community is going to need to use some sort of lift system, whether it's a Hoyer, a sit to stand, whatever it may be, which can be extremely costly. And honestly, it's kind of scary to be in those lifts if you haven't experienced one before. It doesn't feel good to the resident. So if we are proactive, keeping them active and maximizing their independence through mobility, through therapy, through exercise classes, we can keep them independent longer. And lastly, movement and exercise makes us happy, right? There's that endorphin release. It decreases depression, also in senior living communities specifically, and even out in the community. A lot of physical activity is social with other people, whether it's an exercise class, a walking group, walking around the community, garden club, pickleball, you name it. All of those things are most often done with others. And so not only are our seniors getting the physical stimulation and of what they need, they're getting the cognitive, emotional socialization that makes them feel good. For our care force, It's super rewarding to work with every senior, but when a senior is happy, when a senior acknowledges and thanks a caregiver for their support and their care because they're a happy person, that caregiver feels good about their job. Their job is more fun and more rewarding. It feels good to take care of people that are happy. Taking care of people that are grumpy or sad or depressed is more challenging. I'm not saying it's not rewarding, but if we can get them moving, keep them active, keep them socializing in those activities, it really helps our care force as well as our residents. So to kind of wrap up those 6 points, I would ask you to think wherever you're at, whether you're a caregiver, you're a therapist, you're an admin, you're a DON, maybe you're a son or daughter of an elderly individual, think to yourself 1 or 2 ways that you can encourage and increase that senior's physical abilities, and how we can engage them and increase movement as medicine versus first they're always turning to medication or other interventions. For our senior living community folks, this definitely takes a proactive versus a reactive approach. What we know in assisted living and skilled nursing and memory care is a lot of our residents are not independent with mobility, which means that they need supervision to get to the exercise class. They need assist to do the walking club, and that takes staffing. That takes therapists being involved and maybe an individual getting therapy services intermittently or being on a functional maintenance program to make sure that they don't lose the ability to engage in that physical activity and exercise. But the reward of being proactive are to avoid all the things that we just talked about. Pain medication, wounds, wound care, behavioral expressions for our individuals with cognitive deficits, prevents falls, increases independence, decreases the likelihood of someone needing that higher level of care, and prevents depression. So if we think about what it takes up front to provide our individuals with opportunity to engage in exercise and movement, the proactive approach definitely outweighs the consequences that could be for our seniors. So we're going to kind of transition. I'm going to talk about 2 examples. One, an individual resident that we use movement as medicine for, and then also the group approach. These are probably 2 of my favorite stories from my time as a rehab director and executive director. The first one, individual resident, moved into our memory care community, had always been extremely active. She showed dogs with her husband. I think they had 5 or 6 at a time. So they were always walking the dogs. She was big into gardening, and she was just a mover and a shaker. When her cognition started to decline, she had some scary falls at home, which landed her in rehab. It was determined that she wasn't safe to go home. She moved into the community in a wheelchair, but her and her family were bound and determined that she would walk again because her quality of life was really dependent on her getting back to walking. Due to insurance limitations, she could only have 2 or 3 therapy visits a week, which when you're working with someone with dementia, you can't give them a home exercise program and count on them to complete it 2 or 3 times a day. When I would come back a few days later, she didn't know that we had therapy at all, and I was a new person, which is totally fine. But I really had to get the buy-in of the entire care team in order for this resident to achieve her goals. So I worked with the care team, her primary care doctor, also the caregivers at the community. The caregivers started walking her to 1 meal a day, then 2, then 3, then 3 meals plus 1 activity. And so we started incorporating her therapy throughout her day-to-day routine. And this lady ended up walking with her walker for the next year and a half of her life. It wasn't just about the extension of her life, it was about the quality of life in that year and a half that movement gave back to her. She was out in the community. Before in the wheelchair, she was embarrassed to go to activities in a wheelchair because that just wasn't her. And so it increased her socialization, decreased isolation when we got her back to ambulating. And I truly believe that this resident would have passed away a lot sooner if it weren't for us using movement as medicine to get her back to where she wanted to be. And then probably my favorite times in senior living have been hosting and putting on a Dancing with Danae class. So I started this when I was a rehab director, continued it as an executive director, and still go back to the community today to do a Dancing with Danae class at the community that I used to work at. And what I love about it is music and dance makes us want to move. Doesn't matter your cognitive level or your physical level, we naturally want to go along with the beat of music and engage with music. And so, gosh, 5-6 years I've been doing Dancing with Danae, and it's just awesome to see residents low level in a Broda chair, but they're clapping along to the beat, all the way to what I call our passive participators, where they don't want to be a part of a dance class, but they'll walk laps around the community, and every time they walk by the class, they pause, they do a little of the dance or the exercise, and then move on. We've got the people that can stand in the back. We've got people in wheelchairs. Regardless of their level of ability, they are engaged. And the benefits of that movement go way beyond that, that 45-minute class. What we see after the class is dinner plates are scraped clean. Residents are eating better when they exercise. The dining area is bursting with laughter and socialization way more after a dance class or an exercise class versus, let's say, trivia. And I'm not hating on trivia, but again, just the endorphins and the happiness that you get from exercise can be felt in the room. And then the residents sleep better too. When residents sleep better, get that solid sleep, not only is it helpful for their residents, but the caregivers then can complete their documentation, complete their housekeeping tasks. Those other night shift tasks that we all know have to get done are a lot easier, and they're more efficient in getting them done when the residents are sleeping because they've exerted themselves, they've moved their bodies and engaged in exercise. So to finish up here, I would encourage you and again challenge you to think about the seniors in your life and how we can get them moving. Maybe you yourself need to move a little bit more, and you can engage in exercise with them to create a new routine. And if you need help with staffing so that you can take this proactive approach to movement as medicine, or you need more therapists or more therapy interventions for your residents, I would highly encourage you to reach out to myself or anyone on the care team, because we would be happy to help you. I hope you've enjoyed this session, and thanks for listening.